Welcome to Coronavirus Impact. I'm Larry Casper. We have on the phone the mayor of Philadelphia, Jim Kenney. Welcome to our program.
Hi, Larry. How you doing, man?
Mayor, what are your main concerns right now as the outbreak continues?
Social interaction. We have to keep people apart. Obviously we're not a totalitarian country like China, so it's hard to force people indoors. And we've been trying to express to people and explain to them the danger that they're putting themselves and their relatives and friends in by associating closely with each other. Obviously, we closed the schools down, we closed businesses down, restaurants, bars, but people are still congregating. We've taken rims down from basketball courts throughout the Department of Recreation, and we're continuing to have the police interact with our citizens in a respectful way, but to let them know that they need to be 6 feet apart, and they need mostly to be home, which is the best way to keep this thing from spreading.
Are police having much difficulty keeping people apart outdoors?
I mean, yeah, people, Americans usually don't follow rules very well, and that's part of our greatness and part of our problem. But we don't want to get to the point where we're arresting anyone or, issuing, hefty tickets. But we may get to that point if necessary, but we're not there yet. We're having police interact over loudspeakers in their cars to try to get people in. For the most part, however, businesses and residents and citizens have cooperated. The streets pretty dead downtown, and in most neighborhoods, but in some neighborhoods, people are still interacting.
Now, Mayor, that's very interesting. You said that you have already taken down basketball rims. Yep. What else have you done to try to keep people apart while they're outdoors?
Well, we're probably going to wind up closing rec centers at some point, other than those that are being used for food distribution. Libraries are closed, but it's just more continuing to talk to people through social media and through the mainstream media that they need to be in the house. I know it's boring. I know it's hard. But you don't want to bring illness or death to your grandparents or your parents by interacting that way. And we've seen what's happened on spring break in Florida and other places. A lot of these kids are getting sick themselves and bringing that illness home to their families.
What else can the city do to help people get the food that they need?
Yeah, we have 40 sites for boxed food for families. We have about, I think, 80 sites for kids in school-age kids who are dependent upon breakfast and lunch being offered to them during the school day. So we've literally offered 100,000 of meals to folks in the city. I mean, obviously Philadelphia has a high poverty rate, and people depend on certain things. And when you can't get to a grocery store or supermarket, you need to be able to get some good nutritious food to keep you healthy.
I know it's difficult to keep track of numbers at a time like this, but can you tell me approximately how many infected people do you have in Philadelphia?
I think we're last time we looked, I think it's about 1,200. We have about, I think, 70 to 80 people hospitalized, and we've had, I believe, about 14 or 16 fatalities. Most of those fatalities have been people over the age of 70, about 75%. Sad situation, but it seems we're really bracing for the surge. We believe that we're about 2 to 3 weeks behind New York. Obviously, New York has a much higher population, so we won't have the same impact as New York, but we expect to experience a medical bed surge sometime in the next 2 weeks.
How's equipment holding out? Ventilators for patients, protective gear for caretakers?
Yeah, we're scrounging, man. I mean, we have a order that was made in China about a week or two ago. We're still waiting for that to show up for N95 masks, which are the most effective. We have people producing masks, lower grade masks in the city for distribution to whoever we can get them to. This is the one failing of the federal government that really is impactful, is they were not prepared. This stuff was not stockpiled, and now it's on the open market, and it's going for the highest bidder. And we've been outbid. I think one of the orders that I heard of was outbid by Italy for like $15 million. So the market. It's sad to say in this situation, people are still trying to maximize their revenue. and this would have been a great thing for the federal government to take over the production and distribution, but that horse is out of the barn.
Mayor, a deal was being discussed to reopen a hospital to treat COVID patients there in Philadelphia, and the deal fell through. Start at the beginning. What happened?
Well, I mean, the owner of the hospital, Hahnemann, was irresponsible in the operation of the hospital before it closed. Probably was looking at it as a real estate investment more than it was a hospital. And then when we approached him and his people about getting hold of it for overflow patients, the price is $1 million a month, or they wanted us to buy the hospital, which we don't have any need to buy. You would hope that people in this situation would understand, as Temple University did, who was giving us Leah Corus Center and other buildings for free, would have stepped up and did the right thing. So we decided, rather than haggle with this individual, we moved on, and we have other options that we're pursuing. Private hotels, again, Leah Corus Center and Temple University buildings. We have other options. We can go to the Convention Center in Philly if we have really a big surge. Leah Corus Center has about 250 or so beds now. They're expandable to about 400 to 500. If we go over that, we're going to have to move to the Convention Center for as many as 1,000 if possible. Hopefully we won't get to any of that. That the surge won't be as bad, and some of the social distancing things we've been doing will be effective in keeping the curve lower so the hospitals aren't overwhelmed.
Mayor, back to Hahnemann Hospital just for a minute. How did the owner of Hahnemann calculate what he wanted to be paid? You said he wanted $1 million.
Well, what we would have had to renovate the place. You have to understand that basically it's not a hospital anymore. It's an empty building. Mm-hmm. So we would have had to go in and get all the systems, heat and light and all the other stuff up to code. We would have had to stock it with beds and other plumbing and other facilities. So that came up to about $1 million a month, and we would have had to improve his building. So at some point in time he would sell it at an improved condition. And we just would hope that he had been more of a compassionate person and given it to us, and we would have fixed it up and used it.
Mayor, try to convey to our statewide audience what an unfortunate setback the Hahnemann Hospital situation was, and it turned out the hospital owner's home was vandalized.
Yeah.
So are you aware of any other protests from the public? There were a lot of disappointed people out there.
No, I mean, I obviously don't condone, vandalizing anyone's house and terrorizing anybody's family. I mean, certainly we have our issues with him as an individual, but certainly he should not be subjected to that kind of abuse. We just moved on, basically, and we approached him and his people. They gave us a price. We tried to negotiate that price. He wouldn't come down, and now we're moving on. We have access to the Pennsylvania Convention Center. We have access to expanded beds capability at Leah Corus Center. The hospitals themselves can expand into traditionally non-hospital portions of their buildings themselves. So I think we're going to be okay in that regard. It's just a matter of how big the surge is and how fast it comes.
Just one more question about Hahnemann, Mayor. How about this? Candidate for President Bernie Sanders said the city should take the property by eminent domain. Is that a viable option?
No, because eminent domain means you have to pay fair market value for it. So, I mean, you can't just take somebody's property and not compensate them. They'll be in court, and we'll have to wind up paying for it in the end. So, I love Bernie, but he comes up with sometimes simplistic answers to problems that he doesn't have to manage.
Now, I understand, Mayor, you had some protesters outside of City Hall supporting the mass release of inmates to contain the disease. What do you think of that idea?
Well, I mean, I understand their compassion and I understand their thinking. I don't agree with it. There are some people who need to be segregated and separated from the public, who are dangerous people. We've experienced an uptick in shootings and homicide. The remainder of our crimes are down, 20-30%. But guns are available. It's sad to say that in Pennsylvania and in the country, they deemed it to be a necessary business to operate gun shops. I don't particularly understand that whole concept, but they're open and people are selling guns left and right. People are getting a hold of guns legally, and I don't think that everyone there should be mass released. I think there should be a process for the courts to examine each individual's case to see whether or not they're a low level in a low level situation as far as violence goes. But some people need to be segregated and separated because they're dangerous people. And I don't, as mayor, have the ability to release anybody. The court has to agree. The Supreme Court, I believe, is going to weigh in at some point. And individual judges in the Court of Common Pleas in Philly who sign the orders to incarcerate people need to be the court that releases people. So this belief that somehow people can, ride around City Hall with beeping their horns, and I'm going to be able to open the jail doors is not accurate. We can't do anything without a judge's order.
Let's talk about testing. How is the city doing with testing? How soon can it be done? How quick are the results? What have you been seeing?
Well, we've been standing up testing sites along with the hospital community. We're not having as many tests as we would like. The test kits are not available. We're scrounging. It's another thing we scrounge for that we should not be scrounging for. And then that's a failing of the federal government. And we're testing as many as we can. And at some point in time, when we get into the surge, testing is not even going to be an issue. It's going to be making sure we have enough beds, enough ICU units, and enough ventilators.
And if a person is showing symptoms at this point, can you just show up for testing, or do you have to make an appointment?
No, the best thing to do is call your physician or call the health center, in one of the health centers near you in Philly. Do not go to the emergency room directly unless you're having difficulty breathing and you feel like you're going to be in real danger. Call your doctor. They can give you a script to get a test, and there'll be places that you can go get tested if you have a prescription. But for the most part, unless you're having severe breathing problems, you should lock yourself down at home and wait it out. If you do have severe breathing problems, you should call your doctor and then go to the emergency room.
So talk more about the next stage of this crisis, the one you referred to as the surge.
Yeah. I mean, you saw in Italy and in New York what's happening. In France, what's happening with the surge. I mean, it's just their health systems are overwhelmed, and that's why the social distancing is so important, because it turns the curve down, so we don't get as many cases in a short period of time. It's more spread out, and that will allow the hospital systems, hospitals to accommodate people on a regular, predictable basis as opposed to a surge all at once. But if there is a surge, again, Leah Center, what we have currently there, how we can expand that, and then the convention center or other places we're looking at to accommodate the surge beds. And for the most part, the surge beds will not be COVID folks. It'll be people who are in the hospital for other reasons. So we want to get those to a step-down unit, and then they can go home and save the beds for COVID-infected people.
How well are your healthcare workers doing at this point, Mayor? Are they getting sick?
They're getting sick. I mean, every facet of our workforce is seeing some impact from the illness. Our healthcare workers, those young and everyone, the nurses, doctors, people who work in the hospital, they're true heroes. They're truly heroic people, and they sacrifice themselves potentially to take care of all of us. And we should always remember that. Along with our first responders, police, firefighters, EMTs, are out there every day facing danger and standing up to it.
We have just another minute left here, Mayor, and tell our viewers how you want Philadelphians to act in the coming weeks.
I want them to use their common sense. I want them to be less selfish than some people have shown to be, and I want them to look out for each other. Look out for the seniors on your street. Look out for your neighbors, and try to hunker down the best you can in your homes. We will provide food and whatever help the people need. They can go out to shop. They should keep social distance. 6 feet apart from each other, and just let's get through this. I mean, this is a challenging time. I believe that Philadelphia, Pennsylvania, and the United States is up for the challenge. And this, 10 years from now, we'll be looking back on this not fondly, but looking back at it and saying we did the best we could.
All right, very informative. Thank you, Mayor of Philadelphia, Jim Kenney.
Take care, everybody. Stay home.
More coronavirus impact after a short break.
How did that become law?
Does the governor get to decide everything?
Why was that person elected?
PCN wanted to help answer these questions by creating Civics 101, a free online educational tool to teach Pennsylvania students how the state government works. Stream video interviews with elected officials, tour the state capitol and governor's residence, and so much more. Go to pcntv.com to start learning today. PCN Civics 101.
We have on the phone Teresa Miller, Pennsylvania's Secretary of Human Services. Welcome to our program.
Thank you for having me, Larry.
Secretary, tell us about your job in general and what you're responsible for.
So I oversee the Department of Human Services. DHS provides access to health care for millions of Pennsylvanians through our Medicaid program called Medical Assistance and through the Children's Health Insurance Program, what many people may know of as CHIP. We provide services and supports to older Pennsylvanians and people with disabilities. We administer programs like the Supplemental Nutrition Assistance Program, or what we call SNAP, used to be called food stamps, to help low-income Pennsylvanians, children, seniors, people with disabilities put food on their table. We administer a program called TANF, our Temporary Assistance to Needy Families program, which provides cash assistance to very low-income Pennsylvanians. And we're the Child Welfare Agency, so we cover quite a bit.
So, Secretary, that certainly is a lot of programs. So given the outbreak of coronavirus, just where do you start?
Yeah, so, the Wolf administration has taken really bold action in recent weeks to slow the spread of the COVID-19 coronavirus in Pennsylvania. And everything that we as an administration are doing is really intended to achieve one goal. We want to save lives. But the essential functions of our department at DHS cannot and have not stopped. So let me just talk a little bit about what we're doing during these COVID-19 mitigation efforts. First, we are still processing applications for our public assistance programs, including Medicaid, the Supplemental Nutrition Assistance Program, or SNAP, that I talked about a minute ago, TANF, our cash assistance program, and the Children's Health Insurance Program, or CHIP. So these programs are still available during this time. If people need food assistance or health coverage or other assistance, we are here for them. Child care centers are also regulated by DHS, and we are granting waivers for some child care centers to stay open on a case-by-case basis to ensure that people who do still have to go to work, we know there are doctors out there, grocery store employees, a lot of folks who still have to work, these essential employees, we want to make sure they have access to child care. So we are granting waivers to child care centers to serve those workers. It's also important to note that Childline, where people can report child abuse, our adult protective services, our domestic violence and rape crisis programs, those are all still operational for those who need to report suspected abuse or neglect or need assistance. And finally, and this is exciting, we're about ready to announce that we just launched yesterday a statewide support and referral helpline to help Pennsylvanians who are struggling with anxiety and other challenging emotions due to the COVID-19 emergency. So that helpline is available 24/7 now, and it's available at 1-855-284-2494. And this helpline will also refer callers to community-based resources that can further help meet individuals' needs.
Secretary, would you mind saying that phone number one more time for the benefit of our viewers? Slowly, please.
Absolutely. The helpline is available at 1-855-284-2494.
And when is that number open?
It opened last night at 6 p.m. It is available 24/7.
Are there calls coming in yet?
I don't know that. We just turned it on, and I haven't gotten a report yet.
So let's talk about other important services you're working on. For example, the SNAP nutrition program. Like you said, sometimes it's known as food stamps. Any changes there, and how can you reassure the Pennsylvanians who count on that?
Absolutely. This is a really critical benefit for people, and we know food security is a real issue right now. Maintaining access to food is really one of our top priorities as a department right now. We are continuing to process applications and benefit renewals for the program. We also have emergency SNAP applications that can be expedited and issued in 5 days. Pennsylvanians can apply for SNAP online on our website at www.compass, COMPASS, .state.pa.us. And the federal government did approve our request to extend the time that people are eligible to receive benefits, so that will allow us to continue benefits during this crisis and not have those benefits interrupted. We're also working with the federal government on other waivers that will help more people access SNAP during this time. The other thing I would talk about and just mention, because again, food security is such a big issue, we've also operationalized our feeding task force. This is a group comprised of public, private, and nonprofit partners from across the state that includes, among others, the Governor's Food Security Partnership state agencies, and DHS is obviously one of those. It includes the Salvation Army, Feeding PA, and the Pennsylvania Food Merchants Association. So this task force is really a centralized hub where we determine where our needs are, how many meals are needed, and how we're getting food to people and how we're getting volunteers to help charitable food networks across Pennsylvania. So Pennsylvanians who need help feeding themselves or their family should find and contact their local food bank or food pantry through Feeding Pennsylvania and Hunger Free Pennsylvania. We're also encouraging anyone who's healthy and able to consider taking some time to volunteer with their local food bank. We know these operations are seriously altered because of this situation, but their services are and will continue to be incredibly needed as COVID-19 continues to disrupt all of our daily lives.
Now, is there anything your department does, Secretary, to interact with charitable organizations that are trying to get food to Pennsylvanians?
Yes, and in fact, the feeding task force that I just mentioned, we are working with our charitable food networks as part of that endeavor. So we work very closely with a lot of our partners at the food banks and food pantries.
Now, you and the governor have emphasized that the essential services for vulnerable populations will continue. But in the face of this crisis, does that require you to do anything different at all, especially something that would concern our viewers?
Well, I mean, one of the issues that we certainly are facing right now is, as COVID continues to spread, we are going to see impacts to our staff. So we are going to keep these benefits going, and I don't want people to worry about that. But from an agency perspective, we certainly are facing some challenges as more and more people are either quarantining or out of the office. So we're having to also, as we're making sure that benefits continue and we don't have interruptions in these critical services and benefits, we're also on the back end trying to figure out how we maintain our staffing levels. And we also expect we're starting to see an increase in applications. Other states who are a little bit ahead of us in this crisis, they've seen a huge spike in applications. So we haven't quite seen a huge spike yet, but we're anticipating that. And with some of the staffing challenges, those are just some of the things that we're having to figure out because we are committed to continuing these benefits and making sure that people that need our services can get them when they need them.
And as the coronavirus crisis continues to unfold, of course, there are still Pennsylvanians out there who are dealing with opioid addiction. And what about those services? Any impact at all?
I believe, in terms of behavioral health services, these are also essential services. So, people who work in any of our crisis programs or any of our healthcare services, they should still be in operation. So people should still have access to those services. Of course, hospitals are there, but our inpatient and outpatient facilities are still operational because we know, especially now, behavioral health services will be critical.
So it seems that telemedicine is more relevant than ever. How does that figure into your department's plans?
It absolutely is. And so as we think about our Medicaid and CHIP program, both on the physical health side, but also on the behavioral health side, one of the things that we've done and one of the flexibilities allowed by the federal government right now is to do more in terms of telemedicine. So we've been issuing guidance at the department to all of our providers and programs that we work with, talking about how we're encouraging more use of telemedicine than we've really seen in the past, because we really want to make sure that if individuals can receive services effectively over the phone or through a Skype type situation or something like that, that is going to be a much more effective way to do it and help us reduce the spread of this disease.
Is part of your mission investigating claims of abuse and neglect? And if so, how has that demand changed in the last 2 or 3 weeks?
Yeah, so protective services is also one of the important services provided by DHS, and they are still operating. So Childline is available 24/7 to anyone wishing to report child abuse and general child well-being concerns. Mandated reporters, we're encouraging them to report online. We also have adult protective services who protect adults who are 18 to 59 and have a physical or intellectual disability. Those reports can also be made 24/7, and these calls are continuing to be answered and investigated. I don't know that we've seen spikes in those at this point. In many cases, the data around these calls are delayed, so we can't necessarily track it on a day-to-day basis.
So how has staffing at your department changed over the past few weeks? You still have plenty of people to deliver these services?
Well, we do, but I think this is one of the big challenges that's coming for us, because as people struggle themselves with COVID-19 perhaps, or as they may have come in close contact with someone who has the disease, then we're finding they need to quarantine, right? They need to stay at home and self-quarantine. And in a lot of cases, for example, in our county assistance offices where our workers are processing applications and ensuring these benefits continue, those offices, we don't have telework available today. We're working to get that available, but we don't have it available today. So in those offices, we have a lot of people coming into work every day, and in some cases where they may have been exposed, they're then having to quarantine, and if they've then been in close contact with someone else, they have to self-quarantine. So I think as this continues to spread, our concern is we are going to be facing staffing challenges, and we are thinking through and trying to get ahead of this and get creative about how do we make sure we continue to have the staff we need to do the important work that we need to continue to do, even as we may have more and more people out.
And while this crisis continues, child care, of course, is a concern. And I understand there's a website that can connect essential workers with child care providers.
That's exactly right. We know that there are a lot of essential workers out there who are still having to go to work. We have today 780 child care providers who are operating with a waiver. And you said it. We have a map on our website, and our website is www.dhs.pa.gov. And this is a website and a map that essential workers can use to connect with child care centers that are open. So we are also, happy to help individuals who can't find child care, try to help them find it. We are also in some cases recruiting child care providers to reopen to serve some of these essential workers, because we really do want to make sure that these workers can continue to do the important jobs they're doing and know their children are safe.
And last question, Secretary, what's the best way for Pennsylvanians to continue to get the latest information on these important services that we've been talking about?
Absolutely. So on our website, which is dhs.pa.gov, we have a COVID-19 section, and people can get information there. More broadly, information about this pandemic is also available at visit pa.gov, and there's a responding to COVID-19 guide that has a lot of different information, so people can get more information there.
All right, thank you. Teresa Miller, Pennsylvania Secretary of Human Services. That's it for Coronavirus Impact. Join us weekdays at 12 noon and 8 p.m. You can also watch us on our mobile app, PCNTV.com, Facebook, and YouTube. I'm Larry Casper. Thanks for watching.